Hello everyone, I'm Dr. Munro. I'm a plastic surgeon in private practice in Monterrey, Mexico. I specialize in aesthetic surgery and particularly body contouring after massive weight loss. Today we are going to chat with our patient Joshua. He's 30 years old. He comes from Minnesota. He had a vertical sleeve procedure and lost a tremendous amount of weight. And he's visited us in two occasions. The first one to have a circumferential lipectomy, also called a lower body lift or belt lipectomy, and an inner thigh lift. 3 months later, he returns for a circumferential upper body lift, which is a combination of a back lift, a chest lift, and an arm lift. We're going to be talking with him about his journey through weight loss and then his post-bariatric body contouring procedures. And we're going to talk a little bit with him about safety and some of the things that you need to take into consideration when you have these type of operations done. So hope you enjoy it and find it interesting. So Josh, you've been here twice for different body contouring procedures. First, the lower body lift and thighs. And now you just had a couple days ago, actually, an upper body lift, a circumferential upper body lift, which is the back, the chest, and the arms. You know, being experienced in these procedures now, having had, both of the largest procedures that we perform in body contouring, what can you advise weight loss patients that are looking into having this type of treatment?
Well, the biggest piece of advice that I can give is trust the doctor. He knows what he's talking about. You've done a phenomenal job. You've answered all of the questions I've had. You've pointed out all of the different procedures and how they work together. It's what you do. This is your job. And, for somebody coming in, why do I have to make 2 trips? Why can't I just make 1 trip? Well, because of the strain on your body, on my body, between the 2 procedures. Plus, taking you into account, how long, if you were to do it all at one time, how long would a patient like me be under? It's just not possible and it's not feasible. So breaking it up into 2 different procedures is better all around, especially those in my situation that are coming from extreme weight loss and looking into extreme weight loss body reconstructive surgery.
That's very important. What you just mentioned, your health and safety is always our number one priority. So we always want to give you the best result we can. We want to make you as tight as possible. We want to make you, look your best. But we also have to do this with safety. Your safety and your health is very important. So after having had a circumferential lipectomy or a belt lipectomy plus the thighs, and now a circumferential upper body lift where you have a scar right across your back and right across your chest and your arms. You've only been, 2 days after surgery now? So what's the difference as far as recovery from the lower body procedure to the upper body?
Well, I'm glad I did the lower body first. That was the hard one. This upper body, I'm already feeling great. I don't have drains. So the lower body lift included the drains from the abdomen, the reconstruction of the abdominal area plus the inner thigh lift. That was much more intense. The recovery took a little longer, but all in all, it went well. The results are great. I'm very happy with those results. And just now, as we've looked and done the upper body lift, I'm looking forward to how it's going to turn out. We'll take pictures at some point, send them back to you.
Yeah. What was the time frame that you had to wait between one procedure and the next? Because that's a question that a lot of people ask. If we're breaking it up in 2 sessions, how soon can I have the second session? And that's very important because you have to heal from the first operation first. You just can't have a large operation like the first one you had and then jump into the other one right away. some people want to have everything done at the same time. And yes, there are, of course, doctors that offer that type of treatment and that type of service where they'll do a circumferential body lift and thigh lift and chest and arms and back all in one session. But after having experienced the lower body lift first and then having to wait for several months to get the second procedure done and having to see how your body or feeling actually how your body recovered from the first one, would you recommend to have everything done at the same time? And and the other thing that I would like you to tell everybody watching this video is, how long did it take for you to actually feel normal and be at your best after having the lower body lift?
Mm-hmm. So, well, let's break that question down. First and foremost, yes, I would never recommend that you do it all at once. So I would definitely say that you want to break it up into two different procedures, depending on how much work you need done. And that's what the consultation portion is for. Some people only need the belt. I wanted the belt plus the inner thigh because I had extra skin, on the thighs. So it really does matter to get that consultation and to really look at, to have you look at the pictures and see what needs to be done, and then put together a plan on which ones to do first, and then start to look at the scheduling. Now, of course, the scheduling, the second part of the question is, we did the belt and the thighs a few months ago, and that's what you said, and you told me, we need to wait at least 3 months between procedures. That is spot on, because of course initial recovery is a few weeks, so 3 weeks. I was feeling back to normal. The scabs were coming off. Everything was moving and working well. And I was actually just talking with my family back in the holidays how I'm finally feeling normal again, just in time to go back and do it all over for the second round. So, and here we are, back a few months later to do the upper body lift.
So what I always try to emphasize when patients ask this question is that even though recovery is just 3 weeks, the initial recovery is just 3 weeks, it does take at least a couple of months for you to feel back to 100%. That also means that that's the time that your body requires to heal, to be back in your best, and you need to be at your best health to tolerate the surgery that has long incisions that of course your body is going to spend a lot of energy in healing all these incisions. Large scars, you have several feet of wounds to heal now, and that is something that is something to consider. It's not something to be taken lightly, right?
No, not at all. So it is an extreme surgery. There's a lot being done all over the place. So, taking our time to make sure that we're healed properly and we're back to our best health before the next procedure, it's paramount. You have to wait that time.
Well,
no way around it.
Thank you, Josh. It's been great to have you here for a second time. I think we've had some good results with your operation. You've been a very good patient, and thank you for helping us, share your particular case with our patients, and hopefully, shine some light and clear up some questions that we get asked very often. So thank you very much for helping us out with this video.
Well, it's my pleasure. Ever since I got the bariatric surgery and got sleeved, I have been open and honest about my entire story from day one. Because truth be told, there's no hiding this. What did you do? How did you lose so much weight? 250 pounds. Diet and exercise just wasn't enough. So explaining the entire procedure from the bariatric surgery to now to the skin removal surgery, my entire experience, I've been open and honest about the entire part. And so for me to be able to come in and for you to ask me to come here and share my story, it's great. And I want to thank you.
Thank you, sir. Thank you so much for this, for helping us out with this video, and hopefully this is some good information that some people can use and can, of course, relate to your case, right?
Yes.
Thank you.